Hi, welcome to Primary Medical Physicians. I'm here with Dr. Lilly Gonzalez from Gastro Health. Dr. Gonzalez,
Yes.
thank you for being here and taking care of our patients. I saw on Instagram and your social media outlets, by the way, congratulations on that you got a colonoscopy this week.
I sure did.
Okay.
I actually had a colonoscopy yesterday. And it was interesting to take a taste of my own medicine.
Wait, hold on. You got a colonoscopy yesterday?
Yes.
And you're working today?
Absolutely. I worked the day before and I'm back again today.
Wow. And if you don't mind me asking, you're young, and why did you need a colonoscopy?
That's a great question. You know, a lot of people are like, I thought 45 is the age, and that's true. 45 is the age for routine colorectal cancer screening. Now, I did my colonoscopy earlier than that because, like many women, I do have iron deficiency, and part of the workup of iron deficiency, which is a type of anemia, is to do a colonoscopy and also an upper endoscopy, which I won't get into that today, but that's why I had mine done, and so very good question.
Good. And tell me about the prep. Was it horrible as people say?
The prep. So, listen, I'm not gonna lie. It's not fun, okay, but it's definitely doable.
Okay.
So some of you may have seen the day before, you know, I got all my clear liquids in preparation. And one tip I have is get things that are a little bit exciting for you. You know, yes, clear liquids can be exciting too. You know, there's a lot of options these days for our liquids. So, you know, I went and got some you know, the boba tea. So I got myself some boba tea without the boba.
I saw some Gatorade.
There was Gatorade.
Yummy.
There's like a lot of different kinds of clear liquids that we can do. But in addition to that, what really helped is that I did take what we call a low residue breakfast. So I had a hard-boiled egg, a piece of toast, and some coffee for my breakfast, which is acceptable. But I must say, every gastroenterologist is different. So you should check with your gastroenterologist to see what they are comfortable with you having the day before. So definitely follow your gastroenterologist instructions. But for me and my patients, having a low residue breakfast the morning before is acceptable and will not affect your bowel prep.
So is it true that you should avoid red meat, red wines, or anything red the days before the colonoscopy, because it could definitely leave something in our colon, and it could give you a false sense of bleed? Or is that a myth?
So that's a great question. You know, traditionally we always say stay away from the red Jellos and the red Gatorades and whatnot. Honestly, I mean, we can tell the difference between blood and red Gatorade. The thing is that if you drink a lot of volume of these liquids, which you will be the day before, if you consume enough of the red or the blue or whatever, it is gonna leave, you know, we will see some possibly puddles of red or blue in the colon, and you just don't want anything to distract. But I mean, a little bit here and there the day before is no big deal. I myself had some red Jello and orange Jello.
Wow.
That's all I could find.
Okay.
You know, I was in a pinch. Didn't make a difference.
Right.
But if you're gonna eat, you know, drink 2 huge gallons of Gatorade or something,
Right.
better to stick to.
So
less
really
volume.
quick, what are the recommendations for screening colonoscopy?
Okay, so recommendations for screening colonoscopy are to get screened at 45 if you are average risk. If you have a family history of colon cancer, colon polyps, or other issues like anemia, like I did, you need to get checked out sooner.
If your stools start changing, some patients come in at age 40 and tell me, hey, my stool's coming out a little mushy. It's coming out with mucus. Or I'm constipated. If you have a change in stools, do you recommend at least a GI consult, and then maybe you taking it to a colon?
Absolutely. So I always recommend talking to your gastroenterologist if you have changes in your bowel habits. It doesn't always necessarily mean you need a colonoscopy, but certainly come talk to us so we can review your symptoms and recommend what's best for you.
And quickly, the day of the colonoscopy, obviously you were asleep?
Yes. Oh my goodness. It was the best nap I ever had. You know, the day of the colonoscopy, my team took such great care of me. I had a wonderful experience. I did not feel a thing.
But all my patients tell me that they have a great experience where you and Dr. Lanis and Dr. Dabul and do the colonoscopies.
Yeah, we tend to have good feedback, and I was a patient myself, and so I can attest to that. And afterwards, there was no pain, no discomfort. I napped, and then I went back to eating my regular diet.
And you're here today early at 8:30 in the morning, seeing patients. She got 2 of the patients that I've been talking to about getting colonoscopies, and she convinced them. So great job. Thank you for being here. Thank you for this quick questions and answers. If there's any questions, I'll send them over to you.
Yes.
But I really appreciate your help in helping our community fight cancer, colon cancer.
Oh no, thank you so much for allowing me to do this. You know, it means so much, especially like you mentioned, the 2 patients today who put off their colonoscopy for so many years. And with Dr. Issa's help, we were able to convince them to get screened for colon cancer. And those are moments that I really love. Side note, I have some recommendations on how to make that prep a little bit more tolerable because it was not good.
So maybe we'll do that next week.
Sounds good.
Okay, we'll just talk about preps.
Sounds good.
Thank you.
Take care.
Thanks a lot.